on to people who have hepatitis B. I don't think we should discuss it because if you take care of hepatitis B, you can forget hepatitis D. But these are five viruses. Is what about viruses? We need research. Just like you have epidemics of cholera, you have epidemics of gastroenteritis, you have huge epidemics of hepatitis A and B. And the number of people who have got affected with epidemics have been 50,000, 60,000 people at one time just getting hepatitis. Because it's waterborne, it spreads very quickly and can affect many people at the same time. So while it can be seen, what we call sporadically can occur here and there, but we can see large-scale epidemics as well of hepatitis A and D. And can someone tell me what is the easiest way to deal with this matter? What would you do with a waterborne virus? How would you control it? I'm making mayor of Bangalore. What would you do? It's you want to clean water supply.
यार वो पे join आके तेरे
Water and sewage board. Sometimes there is very right for it, sometimes it goes the same. So this is one of the things that can happen. That's why you can get these epidemics. And so you have to make sure that if your water source is clean, you can prevent these very easily. Then comes the transmission of hepatitis B and C. We realize that it is called serial hepatitis. That means it's transmitted through blood and blood products. I realized that blood transfusions, when I came here in 1985, we had many blood banks there, and no one tested for hepatitis B. So every month you see at least a dozen patients of who's received a blood transfusion 2-3 months back. Now you come to us with jaundice, is what hepatitis B. So we knew that blood transfusions, and of course, anyone over the age of 50 years, except
so many members. Yes, sir.
I don't know, but I was
Other more than 50 years.
and he gave you an injection. And then he boiled that injection at the needle and he uses someone else. If you went to Bowling Hospital, where I sometimes went when I was a kid, the nurse would have one big syringe full of medicine. And you went, you put one needle, gave you, pulled out that needle, put another needle, gave to the next guy, and so on and so forth till that whole thing's over. They did not have the concept of disposable syringes and needles. It was the same thing used again, and a lot of times they did not have time to boil it or sterilize it. So through needle stick or through contaminated needles, that was one way this infection was being transmitted. At some time, they realized that you can transmit this infection sexually, like any other sexually transmitted disease, because this virus is there in the cervical secretions of the women or in the semen of men who are infected at times. So sexual transmission can happen. But it was not for a long time realized that a bulk of the transmission occurs from mother to child. That's vertical transmission from one generation. And that can occur when the baby is in the womb through the placenta or in during childbirth when the baby is in contact with the maternal secretions. So mother to baby transmission actually is the biggest way of transmission of hepatitis B virus. Okay, so you have blood blood transfusion needs a section for transmission. The other thing that we also realize that if you have a patient who has got hepatitis B, this this rest of his family, there's a 25% chance that someone else will also have hepatitis. One is that they may have the same mother. Or what can happen is horizontal transmission to very close contact in the family. Men lower middle class homes, when twins slept together, six cousins slept together. White, so we never had a toothbrush, fortunately, we just brushed the fingers, but we use the same towel. We had such close contact. It was not common for an intrafamilial spread as well. So I'm going to ask this lady, the third, I like color greens. You don't look bad. So how will you prevent this vertical transmission? Mother to baby, how do you prevent?
Landscape blocked into this. Right? Interesting, but they locked it. Locked it, कितने हैं? चिपक को मुझे lock.
Two big messages. What happened when this came into papers, right? When she said she was in the Smithkline region. When they brought out the first hepatitis B vaccine, we had all kinds of things going on. She said hepatitis B is more contagious than HIV, more dangerous than HIV. Then people were scared, phobia, says, oh, that barber shop is where I'm getting the hepatitis B. That fellow is not cleaning the blades. I'm not going to go to barber shop at all. And go to someone in Commercial Street or Brigade Road because it looks